Good morning, everyone. Today we are going to talk about the traditional methods of treatment for health issues related to the nervous system. Our group members include Annie, Rachel, and Zining.
What is nervous system? The human nervous system is made up of a network of nerve cells or neurons. This system is divided into two main subsystems, which is the central nervous system and the peripheral nervous system. The central nervous system includes the brain and spinal cord. The peripheral nervous system consists of 12 pairs of cranial nerves and 31 pairs of spinal nerves. The cranial nerve send nerve impulses from and to the brain, while the spinal nerve send nerve impulses from and to the spinal cord.
The examples of health issues related to the nervous system are epilepsy, blood paralysis, multiple sclerosis, Alzheimer's disease, Parkinson's disease, Lou Gehrig or amyotrophic lateral sclerosis, attention deficit hyperactivity disorder, and autism. Now we proceed to the factors and effects of the diseases to an individual. The factors of epilepsy is the occurrence of abnormal activities in certain parts of the brain, causing the nerve cells to produce unusual signals. Head trauma as a result of a car accident or other traumatic injury can cause epilepsy. Some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, run in families. In this case, it is likely that there is a genetic influence. The effects of epilepsy is a person suffering from epilepsy may become unconscious and experience muscle spasms. The occurrence of seizures is increasing the risk of injury, hospitalization, and mortality. It adversely affecting a person's mental health, often resulting in anxiety, depression, or cognitive impairment. Then the second one is brain paralysis. The factors of brain paralysis is brain paralysis occurs because of brain damage before or after a baby is born. It could also possibly occur in children between the ages of 3 to 5 years old. Asphyxia neonatorum or a lack of oxygen to the brain during labor and delivery. Head injuries as a result of a car accident, a fall, or child abuse. The effect of brain paralysis is this disease causes failure in muscles and the ability of motor neurons to function properly. People with brain paralysis also may have impaired vision or hearing and language and speech problems. Cerebral palsy can lead to seizure disorders, mental retardation, and obesity if the child is unable to move freely.
The third is multiple sclerosis. Multiple sclerosis is a progressive disease as a result of an abnormality in the immune system that attacks the myelin sheath in the brain and spinal cord. Multiple sclerosis isn't directly inherited, but people who are related to someone with the condition are more likely to develop it. The chance of a sibling or child of someone with multiple sclerosis also developing it is estimated to be around 2 to 3%. It is more common in countries far from the equator, which could mean that a lack of sunlight and low vitamin D levels may play a role in the condition, although it is not clear whether vitamin D supplements can help prevent multiple sclerosis. The effects of multiple sclerosis is the damaged myelin sheath prevents the transmission of impulses from and to the brain, and the problems with hand-eye coordination, muscle weakness, balance, and gait may occur, because higher risk of developing osteoporosis due to common multiple sclerosis treatments and inactivity. Next is Alzheimer's disease. The factors of Alzheimer's disease is increasing age, but these disorders are not a normal path of aging. Another strong risk factor is family history. Those who have a parent, brother, or sister with Alzheimer's are more likely to develop the disease. And the effects of Alzheimer's disease is the loss of ability to reason and to take care of oneself. The patient is usually confused, forgetful, and disoriented even in a familiar place. If the deterioration of the brain continues, the patient will lose all the ability to read, write, eat, walk, and talk. And here is the data of Alzheimer's disease.
Parkinson's disease is caused by a loss of nerve cells in a part of the brain called the substantia nigra. Nerve cells in this part of the brain are responsible for producing a chemical called dopamine. Researchers have identified specific genetic mutations that can cause Parkinson's disease, but these are uncommon except in rare cases with many family members affected by Parkinson's disease. The effects of Parkinson's disease is it is the shrinkage of the nervous system that causes tremors in the limbs, jaw, foot, and face. The patient will also have difficulty maintaining body posture and balance. They may have experienced cognitive problems, dementia, and thinking difficulties. These usually occur in the later stage of Parkinson's disease. Such cognitive problems aren't very responsive to medication. Lou Gehrig amyotrophic sclerosis is caused by the deterioration and death of motor neurons that control the movement of muscles such as chewing, walking, and talking. Smoking is the only likely environmental risk factor for Lou Gehrig amyotrophic sclerosis. The risk seems to be greatest for women, particularly after menopause. It affects voluntary control of arms and legs and leads to trouble breathing. Over time, Lou Gehrig amyotrophic sclerosis paralyzes the muscles you use to breathe, and we might need a device to help us breathe at night, similar to what someone with sleep apnea might wear. For example, we may be given continuous positive airway pressure (CPAP) or believer positive airway pressure to assist with our breathing at night. This is the data information of ALS. Attention deficit hyperactivity disorder. This tends to run in families, and in most cases is thought the genes inherited from our parents are a significant factor in developing the condition. Research shows that parents and siblings of a child with ADHD are more likely to have ADHD themselves. Research has also identified a number of possible differences in the brains of people with ADHD from those without the condition, although the exact significance of this is not clear. For example, studies involving brain scans have suggested that certain areas of the brain may be smaller in people with ADHD, whereas other areas may be larger. The effects of ADHD is people with ADHD may have trouble paying attention, controlling impulsive behaviors, which is may have acted without thinking about what the result will be or be overly active. Children may have trouble learning or developing social skills, while adults could have problems with relationships and addictions. The disorder could also lead to mood swings, depression, low self-esteem, eating disorders, risk-taking, and conflicts with people around us. This is the data of ADHD people.
The next is autism. Autism is a type of disease related to the development of nerves in the brain. Several different genes appear to be involved in autism spectrum disorder. For some children, autism spectrum disorder can be associated with a genetic disorder. For other children, genetic changes may increase the risk of autism spectrum disorder. Still other genes may affect brain development or the way that brain cells communicate, or they may determine the severity of symptoms. Some genetic mutations seem to be inherited, while others occur spontaneously. Autism causes an individual to experience problem communicating and interacting. If you have autism, you may be very sensitive to sensory input. Something as common as loud noises or bright lights may cause you significant emotional discomfort. Alternatively, you may not respond at all to some sensations, such as extreme heat, cold, or pain. Seizures are common among people with autism. They often begin in childhood or your teenage years.
Now let me introduce the traditional methods to treat the diseases and the effectiveness of the traditional methods. The first traditional method is herbal treatments. To treat epilepsy, some of the most commonly used herbs are burning bush, groundsel, hydrocotyl, lily of the valley, myrtle, mugwort, peony, screwcap, and etc. To treat Alzheimer's disease, some herbs are effective because of their anti-inflammatory and antioxidant properties. For example, ginkgo biloba may benefit people with cognitive impairment caused by AD. Be sure to report any use of herbs or alternative approaches to your doctor. Many herbs interact with other medications. Ginkgo biloba is known to be a blood thinner and can be dangerous for people already on blood thinners. To treat Parkinson's disease, mucuna plants are known to contain levodopa, a key Parkinson's medication that increases dopamine levels in the brain and therefore improves the motor symptoms of the condition. Some herbal treatments can have serious side effects and interfere with Parkinson's medications. Always talk with your doctor before taking any herbal medicines. To treat attention deficit hyperactivity disorder, herbs can help calm a person, and they may play a role in memory and thinking. The effectiveness of herbal treatment in epilepsy is the safety, side effects, and interactions are not well studied. The Food and Drug Administration also doesn't regulate herbal supplements. Herbs sometimes cause unpleasant side effects such as headaches, rashes, and digestive problems, or even death. Currently, there is not enough scientific proof that most herbal remedies successfully treat epilepsy. Then, the effectiveness in Alzheimer's disease, more research is still needed on whether there is a positive connection between herbal medicine and AD. Current findings are not very convincing. In Parkinson's disease, several studies into leukemia, plants, and Parkinson's have had positive results. However, a rigorous clinical studies into this is needed. In attention deficit hyperactivity disorder, herbal treatments such as ginseng, lindong, and bacopa may show promise for treating ADHD. However, large-scale research studies are needed to find out whether all these natural supplements and medicines are safe and effective.
Now, let me talk about acupuncture. To treat multiple sclerosis, some people report that acupuncture, a practice that places needles at specific points in the body, relieve symptoms like pain, muscle spasms, or bladder control problems. To treat Alzheimer's disease, this therapy is thought to stimulate the body and improve the flow of energy. According to some studies, acupuncture may improve mood, energy levels, pain, and cognitive function in people with Alzheimer's disease, but more research is still needed. To treat Parkinson's disease, it helps alleviate such issues as fatigue and poor sleep. Some studies in animals have shown that acupuncture can be neuroprotective, which is slowing the degeneration of neurons that lead to Parkinson's disease. To treat low-grade amyotrophic lateral sclerosis, acupuncture has been proposed as amyotrophic lateral sclerosis treatment and a way to slow, stop, or reverse progression. Acupuncture was associated with improved motor neuron survival and delay loss of motor performance. The effectiveness of multiple sclerosis of acupuncture is scientific studies haven't found for sure that it works for people with multiple sclerosis. And for Alzheimer's disease, there is little risk with acupuncture done by a trained and licensed practitioner. It may be worth trying for other health benefits. For Parkinson's disease, those studies haven't been replicated in humans. For low-grade amyotrophic lateral sclerosis, acupuncture was associated with improved motor neuron survival and delayed loss of motor performance. Large series suggest that acupuncture is generally safe but not entirely without risk.
And now we proceed to hypotherapy. Hypotherapy is a form of therapy used to improve muscle tone and mobility. It involves horseback riding and channeling a horse's natural movement to improve mobility and posture over time. Hypotherapy is also referred to as equine therapy. It can be used to treat brain paralysis, to be used to improve abnormal muscle tone, impaired coordination, decreased mobility, poor posture, impaired balance, and impaired lipid system function. The effectiveness of hypotherapy to brain paralysis is there is a bond that often develops between a rider and a horse. This can provide an important source of motivation, confidence, and encouragement for an individual with cerebral palsy.
The next traditional method is reflexology. To treat multiple sclerosis, a trained therapist called a reflexologist applies gentle pressure to the soles of your feet or sometimes your hands. The idea is that different points on your foot connect to different areas of your body, including your organs, and that the pressure can improve symptoms. The effectiveness is research is not robust, but many people with MS report that reflexology helps lessen pain and fatigue and improve mood.
And now let's proceed to diet and supplement. To treat Lou Gehrig amyotrophic lateral sclerosis, insufficient intake of nutrients and energy and weight loss are common in people with amyotrophic lateral sclerosis. Decreased food intake occurs mainly because of symptoms such as difficulty swallowing, as well as issues with hand grip and movement. In addition, digestive symptoms and malnutrition can exacerbate symptoms, and the effectiveness is proper diet and nutritional supplements may help prevent or alleviate malnutrition in amyotrophic lateral sclerosis patients.
Biofeedback is a method to treat attention deficit hyperactivity disorder. It is supposed to help people control their own response. It involves a big commitment from your whole family. Effectiveness of biofeedback studies on its effectiveness were done with very small groups of children and were not clear. It is still considered to be an experimental treatment.
Now we proceed to the application of these traditional methods in Malaysia. First, let me introduce the herbal treatment. The data of information is many herbs are believed to be beneficial in curing diseases, in addition to improving the general health and well-being. With the booming of many herbal and traditional medicines into local markets, it is feared that the harmful side effects might prevail over their potential benefits, as there is a lack of or even no scientific basis for the belief. Its herb located in Klang Valley, Seremban and Muar districts in Puchong district. Then the problems encountered by the practitioner is it is feared that the harmful side effects might prevail over their potential benefits, as there is a lack of or even no scientific base for the belief. Production and sale of traditional medicines might pose some issues in relation to their safety to the consumers, as they contain some new active ingredient of plant extracts, which are chemicals that have the potential of causing adverse implication to health, similar to those purified medications. The methods to overcome this paper concludes with some suggestions, such as imposing the requirement of clinical evidence and adopting a systematic post-marketing surveillance to overcome the problems, and weaknesses of the current legal medications in regulating products of herbal and traditional medicines. The next traditional method is acupuncture. The data of information is several traditional therapies can aid or complement modern treatment in the recovery and rehabilitation process of post-stroke patients such as massage, acupuncture, and others. Acupuncture is a branch of traditional Chinese medicine. In Chinese, the word acupuncture means to prick with a needle. Acupuncture is performed by inserting fine needles at particular meridian points of the body to release any blockage in the flow of the qi. Tongsen Hospital is a 346 bed tertiary acute care hospital in Jalan Pudu, Kuala Lumpur, Malaysia. Problems encountered by the practitioner is acupuncture is an invasive procedure that is also associated with risks of complications such as puncturing of internal organs such as lungs, major blood vessels, infections, and bleeding. The methods to overcome is these risks can be minimized if necessary precautions are taken during the procedure.
And now let's proceed into hippotherapy. Hippotherapy is a physical, occupational, and speech therapy that utilizes the natural gait and movement of a horse to provide motor and sensory input. It is based on improvement in neurologic functions and sensory processes, and used for patients with physical and mental disorders, especially in paralyzed individuals. It contributes to physical rehabilitation programs. There is such place which provide this treatment. It is Happy Farms Malaysia, which is located in Putrajaya, Malaysia. The problems encountered by the practitioner is clinical issues such as the client putting self at risk of injuries. For example, bites, falls, and kicks, if not cautious enough or complications insufficiently prevented. And the methods to overcome it is to develop educational activities for informed consent to this type of rehabilitation. And the next is reflexology. Reflexology, also known as zone therapy, is an alternative medical practice involving this application of pressure to specific points on the feet and hands. This is done using thumb, finger, and hand massage techniques without the use of oil or lotion. It is based on a pseudoscientific system of zones and reflex areas that purportedly reflect an image of the body on the feet and hands, with the premise that such work on the feet and hands cause a physical change to the supposedly related areas of the body. The problems encountered by the practitioners and method to overcome it is from any patients or for diagnosis or infection status. The therapist should apply the precaution in client's handling at each encounter with a patient or client and consider every person, patient, or staff as potentially infectious or susceptible to infection. According to good practice guidelines on reflexology for reflexologists practicing in Malaysia, precautions also should be taken when applying treatment to clients with the type of conditions such as pregnancy, cardiovascular disorder, diabetes, osteoporosis, and so on. And the reflexology centers in KL and Selangor is Urban Retreat Spa and Comfort Food Reflexology.
Diets and supplements are substances you might use to add nutrients to your diet or to lower your risk of health problems such as osteoporosis or arthritis. Example of the place that provides this treatment is Healthy Malaysian Dishes, which is Nasi Kerabu in Ikan Bakar. The problems encountered by the practitioner is the Ministry of Health has banned the selling of Acarberry ABC in Malaysia due to adulteration with sibutramine, which may risk and harmful to cardiovascular disease patients. As for Malaysians, it is not safe to consume the product that contains with controlled poison without consultation from physician or pharmacist. The methods to overcome the problems is the Malaysians should always consult with a physician or pharmacist if any confusion regarding any product that they have been consumed. Next one is biofeedback. It is a technique you can use to learn to control some of your body's functions, such as your heart rate. During biofeedback, you are connected to electrical sensors that help you receive information about your body. It helps you make subtle changes in your body, such as relaxing certain muscles to achieve the result you want, such as reducing pain. In essence, biofeedback gives you the ability to practice new ways to control your body, often to improve a health condition or physical performance. The problems encountered by the practitioner is it is generally safe, but it might not be appropriate for everyone. The biofeedback device might not work properly on people with certain medical conditions. The methods to overcome the problem is to be sure to discuss it with your doctor first. So we can make the conclusion that most of us just take it for granted our nervous system is working properly. However, if our nervous system is not functioning at peak performance, then we are not at our best. Irritability, decreased mental acuity, fatigue, and pain are just a few symptoms one could experience. So there is some prevention and ways is we can exercise regularly, talk to your doctor about an exercise plan that will be right for you, and do not smoke or use other tobacco products. Get plenty of rest, take care of health conditions that may cause decreased nervous system functioning, and eat a balanced diet. Yes, also we must drink plenty of water and other fluids to help prevent dehydration, which can cause confusion and memory problems. We also do not use alcohol or illegal drugs, which can affect functioning long after use. And always have your hearing or vision checks. When you do not hear or see well, it is hard for your brain to record information. This is our group references. So many thanks to the Form 4 biology teacher, Madam Nguyen Wei Ping, and her help for us to complete the project on this tutorial. The same words are addressed to our parents for their encouragement and their support until we successfully complete this project, not forgetting our hard work and as well as all parties involved either directly or indirectly throughout the period we complete this project. This is all from us. Thank you for listening.